Dr. Craig Marker is back, and we have some pieces to pick up and further reflection. So I'm so glad to connect with you after a couple mishits due to widespread power failure in the south of the U.S. I hope you guys are okay now.
All is good. It was a kind of a very targeted hits, a kind of random power outage. So
a targeted attack on a beautiful university. I'm sorry about that. Yeah. Well, you had some great comments on our last show about fission and fusion in terms of it's the same thing as feast or famine when we're talking about your dietary practices, the benefits of fasting, but also the importance of performance and recovery. The listeners, I shall remind you that this guy is on the war path. He's trying to dunk at an advanced age and do all those wonderful kettlebell workouts that you share with everybody so much. So we're kind of in the same boat, Craig, because I'm also in those higher age groups, higher than you, and struggling and trying to figure out this puzzle where I know I don't want to sit on the couch and watch other people perform, but then I also don't want a litany of aches and pains and minor injuries and difficulty recovering from workouts. And so maybe we should hit this this concept of where popular dietary practices fall into place with people who are generally metabolically healthy, fit, good blood markers, good body composition. Does Brad Kearns and others need to fast at all or play around with keto, low carb to tap into these vaunted benefits? And I'm referencing my recent shows with Energy Balance podcast, Jay Feldman, who makes a really compelling argument that any sort of dietary restriction, such as fasting, time-restricted feeding, keto, low carb, is a form of stress. It actually turns on stress hormones, and that's the mechanism by which they work and bring you the wonderful benefits. But the same is true for high-intensity exercise.
Yeah, I think, and I hope you'll challenge me and if take Feldman's ideas and really challenge me with this, because we've had some awesome email discussions about this. I think I'll just kind of start it with this caveat that for 99% of the population, we don't have to worry about over taxing the body. Exercise is darn good for them. And we shouldn't be talking about overtraining. It's our little secret. The 1% room can have a secret about it and talk about overtraining. But for 99% of the people, just train and get at it fast, do whatever you need to, and those type of things. Your listeners are a whole different story. They're part of this club of I think people that might be overdoing it at times. And so I think there's, different things that we have to think about. I think for most people, we talk about overtraining way too often, and it's not a problem for most people. Our bodies are pretty good at figuring out, hey, you shouldn't do this. There might be a difference between overtraining and training less smart than we should. That, and you and I were talking about this before we started, but I did a snatch test this weekend. Somebody said, in a snatch test in kettlebell world is putting a 24 kilogram or 55 pound kettlebell over your head 100 times in 5 minutes.
In how many minutes?
In 5 minutes.
Oh, mercy.
So, and I'm not going to let some young whippersnapper beat me on this snatch test. So of course I'm going to do this. And I haven't done snatches in a year. But there was one movement where I kind of went internally and I felt a little bit of a pop in my biceps and a part of the internal part of my bicep. And I thought that was a stupid thing for me to do. It wasn't overtraining. It was just dumb for me to do. So, I think that's part of it, is that sometimes we equate dumb training with overtraining. And that's, I am certainly guilty of that as well. But yeah, no, let me stop for a second. I'll just keep talking about this, but I've got a few ideas on this. I want you to, I think we had really good discussion about it. So.
Yeah, and I think there's an overlay there, and you've written about this. And of course, this lends to your day job, your work in the psychology field, and especially with anxiety, anti-fragility, things of that nature, where we would benefit from putting our body into all forms of challenge, not just getting up and working out more, but going to the grocery store and greeting people in the front. Didn't you take the group there and had them go through this exercise because they were feeling shy and withdrawn or whatever, going out of your comfort zone? And so mixing in more of those, and I think that's where we get into the popularity of the cold plunge and how it represents a way of overcoming the body's fears and anxieties in a micro exercise that can then ideally play into all manner of lifestyle behaviors and goals and challenges that you face or withdraw from if you become fragile due to the comforts and conveniences of your confined day.
Yeah. You know, what you just said reminded me of this Far Side cartoon, and it was a crane with like kind of a phone booth type thing on it. And so the person's inside the phone booth, there are snakes coming out the window, and it says our new exposure technique for a fear of heights, fear of snakes, and fear of closed in spaces. And I think that could be problematic. I think the right amount of stress at the right time, and when we do stuff with, we'll talk about exercise, it's much easier, but with anxiety disorders, you know, it's a piece by piece. We take a little bite of it, and then we, you know, finish that challenge, and then we do the next piece. We don't, you know, throw snakes on the person and then the next thing and just keep trying to make it as bad as possible. You know, it's one thing at a time. And I think the same thing with our other hormetic stressors. You know, the cold plunge is great. And part of our conversation was, should we be doing cold plunge on a fast after intense training? You know, those type of things. And the answer probably, as usual, is it depends. It might be, you know, you might be able to handle that. You've used to the cold plunge, body's adapted to that. It knows how to uncouple the in the mitochondria and build heat. For somebody else, that's a major stressor and a much bigger deal. So I think it probably is dependent. And, you know, as we do this more and more, we get diminishing returns out of these, but also diminishing stress out of these type of techniques. And you know, that's maybe when we have to add on the next piece. I should maybe try some fasting every once in a while.
Yeah, I'm thinking of this in the context of that common refrain in the fitness scene where they want you to mix up your training so that you don't get used to your regimen. And I kind of recoil when I hear it, because I always go to Jack LaLanne, who I had the good fortune of interacting with personally when I was a kid. We played golf together, and I would see him a lot at the golf course. But, you know, when you're doing 1,000 push-ups and 1,000 sit-ups every morning, I don't think Jack LaLanne needed to mix it up in order to continue his fitness progress, because if you can get to a certain level and then be able to perform and be well adapted to it so it's not highly stressful. Same with Kipchoge, the greatest marathoner of all time, where his training log has been published on the internet. People have scrutinized it like crazy, and it's like, the guy's a machine. He runs 20 miles a day at a very good pace with interval workouts and all these things thrown in there, but he's well within his capabilities at all times, to the extent that he doesn't even need to taper before major marathons. He just puts in his work every single day, but it's so minimally stressful to him that he's, you know, he can rise up to bust a world record when he does want to open the throttle a little bit.
That's amazing. Yeah. No, I think there's the term "keep your body confused" is just kind of I agree with what you said. I don't think we need to keep our body confused. It's probably good to have an overall program that you're working, you know, if I were doing push-ups all the time, I'd want to make sure I do some sort of pull movement or something along those lines. But for the most part, I don't need to go in and, you know, one week do such and such, and the next week change it up to another program. And, you know, I can stick with the same, you know, I think that's why kettlebells have really resonated with me. I know exactly what I need to do to get to my hinge, my squat, my pull, and my press. And those sort of four basic, you know, 2 upper body push and press, or press and pull, and then 2 lower body hinge and squat, you know, kind of covers what your body needs to do for the most part. So
what do you think about that common commentary that we are obligated to fit in this so-called zone 2 comfortably paced cardio if we want to get a full report card as an all-around fitness enthusiast?
I've struggled with this, to be honest. I've toyed with this idea, and, you know, I think it's a sort of a univariate type thinking where we're thinking of one variable. I think it's great. Build your aerobic system, have that base. But when you do any sort of circuit training or interval training, that aerobic system's kicking in, cleaning up the mess from the glycolytic system. You're building your aerobic system. If our goal is to be an ultra runner, zone 2 training is outstanding. I wouldn't know what else to program for somebody. But if your goal is to be you and to have world records in speed golf and high jump, I don't think, I think having that sort of quickness, that quick type 2 muscle fibers with that aerobic base built into it, I think that's probably what you want to do. And for longevity purposes, I wonder, do we get enough of that aerobic base from our other training that we don't have to spend 50 minutes doing type zone 2 type training? I question it. I feel like I should do 6 months of zone 2 training and see what it does to me. But I also feel like I have a pretty good base without doing it. And I don't know how much, more I can gain, and would I want to, would I benefit that much from it?
Yeah, well said. I've done it for 40 years, so I can also comment that the specificity of training is so important, and there's just no way around the puzzle of, if you want to participate in a certain competitive event, you have to prepare for it and approximate it. But I contend that you can get that aerobic conditioning in so many ways. And Dr. Phil Maffetone's good about pointing out that going really, really slow, such as walking, will stimulate an aerobic training effect, a very significant one. As soon as you get up off the couch and walk to the mailbox, you're doubling your resting heart rate in most cases. And so it could be that we need way more zone 1. I don't even know if that's a term, but walking and moving and just staying active. And then when we're doing those more strenuous workouts, we're getting a fantastic cardiovascular conditioning effect that kind of negates the importance of going out there, especially moving in a straight line. And I have a video on YouTube I talk about a lot, Jogging 2.0, where I started mixing up my daily jog. I take the dog out. It's no big deal. I'm going very slow. I hardly count it as a big workout or training session. But then I started doing jumps up and down the bench and doing some balancing drills, and then walking because something I did was strenuous, and then jogging again, and then finding another challenge. And it was way more fun. It was more interesting. It developed diverse fitness skills. And I guarantee you, I didn't lose any conditioning by taking those walks in between things that got me breathing a little bit hard. And when I got back to the house, it's the same level of difficulty as just a straight ahead jog.
That's awesome. No, it's great. I mean, and yeah, you're really the expert on this. I mean, back in the Primal Endurance book, I mean, that's the main point take home that I got was, do things either really slow or really fast, and, kind of vary it up. You need both of those areas. So I like that running 2.0 stuff too.
So back to that positioning of the diet. And again, I think your comment that 99% of people who don't move enough and don't exercise enough are out there, maybe not listening as much as I wish to this show. They'd be hit with some new information. Wow! But then with the eating strategy of someone who's got performance recovery and longevity goals, wonder if we can talk about that, especially this kind of different contention that I'm fascinated with, that maybe I should get up every morning and slam a big bowl of fruit and a giant protein smoothie, rather than my typical inclination over the years, which would be fasting. I feel fine. I'm doing a workout. I'm not hungry. I might have a square of dark chocolate here and there and another square, and then have a big meal at midday. But maybe I'm possibly interfering with peak performance and recovery by turning on too many dials of cellular stress and so forth.
Yeah, I think what you said, the goals of performance, recovery, and longevity, we can hit all three of those goals, but sometimes we have to choose we have to choose a little bit more or less of one. If your goal is to, break the high jump record, like I think, that's you might focus on that, and you might do things a little bit differently. But your goal is also longevity, so you might give up some of the things that you might give up a little bit of performance. So I think it's just that balance. That I don't think there's a black or white answer on this. We're trying to balance it. By me fasting in the morning, I might be long-term helping my fat adaptation and burning more fat, and doing it on exercise. I might be training my body something different, but I'm not performing as well as I could be at that moment. And long-term, my training could maybe benefit, I might be stronger in the long term if I were to eat right beforehand. So I have to decide what's a little bit more important. I'm going to give up a little bit on performance for those longevity benefits. And I wish there was a clear-cut answer that maybe one of these shows will finally find the right answer and we can just quit doing this. But I don't know what it is. I think we're giving up a little bit each time. I was trying to think of an analogy when you were bringing this up by email, and that pendulum analogy is what I keep coming up with. That we want to swing between mTOR in the muscles, and we want to swing towards AMPK and blocking mTOR, and that back and forth. And when we fast, we have more AMPK, we have more signaling that we need more mitochondria, and our high intensity does the same thing. And then when we swing to mTOR in muscles, we're building more muscle strength and those type of things. I think our goal, if we're trying to, I think of the speed bag. I'm not that great on a speed bag. And that's what we're trying to do with our life, is that speed bag. Like, you guys have to hit it, let the pendulum go, and you add a little bit more momentum and just keep going. And you've got to get that rhythm down. And I think that's what we need to do, is we start slow, add a little bit, get a little bit faster by adding a little bit more to it. And we get better and better at that speed bag, but we're just playing with our pendulum. We can't change it. If I can easily screw up the speed bag, and so it's stops and hits me in the face or whatever. It's easy to screw that up. But if I get the right rhythm and the right speed, it's a beautiful thing. And I think that's what we're trying to do with our bodies, is get that pendulum going just a little bit farther, a little bit faster.
Yeah, but not jump the gun and get too excited and try to go faster and then you screw everything up. Or I've noticed playing with the speed bag, like I'll get excited that now I'm finally in the groove, and I might smile, or I'm really thinking a thought like, all right, now I got it, and that's exactly when I screw up. Like when you get out of that flow state and start congratulating yourself or observing yourself. Oh my goodness.
Definitely so. Yes. That feeling of accomplishment. I'm doing it. Oh, not anymore.
Not anymore. Hey, look over here. And not anymore. Talk about the pendulum effect with relation to your work with post-traumatic stress and how the human resiliency comes into play.
Yeah. I think I'm not like a big researcher in post-traumatic stress, but I will reference some people that are. What George Bonanno has found, he's looked at people who've had a stressful incident. So a major thing happens, I think one of them was 9/11. He just surveyed a bunch of people and watches what happens to them over time. And I think for most of us, we think as a stress that we're going to develop symptoms and be struggling with the stressor for the rest of our lives. And what he showed with his data was, for the most part, after one stressful life event, people have a trajectory where they might have a little bit of increase in traumatic stress symptoms, but then over time it goes back down naturally without any sort of intervention or any sort of treatment. That's the natural pattern for things. We have a very good sort of immune system associated with our resilience immune system. So we bounce back pretty well for most things. A lot of people have done research on this, but Dan Ariely is another person that looks at happiness and how well we predict things. And if we predict we're going to win the lottery, we're thinking, God, I'm going to be so freaking happy. I'm going to do this. I'm going to be, how am I going to be next year? I'll be just as happy as I am right after I win it. Terrible prediction, because our happiness goes right back down to where it was before we won the lottery. Same thing if we we have a big loss, some sort of loss in life. We think, well, oh gosh, I'm going to be terribly sad. I'm going to be devastated. I won't be able to survive this. But shortly after, we go back to where we were. And so we have this happiness immune system that brings us back to where we were. I don't want to say all trauma is like that, because there are certainly, I'm talking about a one-time stressful event. There are people that have gone through multiple traumatic events, repeated traumatic events, and I don't want to say that they're not resilient. It's just a whole different, a different ballgame with that. It's a different type of life event, especially kids who go through multiple traumatic events. I'm not talking about that at all. But I think for the most part, we have an immune system that helps us get back to where we were much more than we expect. And we think we need to do some sort of intervention. And I think sometimes, and I keep emphasizing think, but I've seen cases where we try to help people and that actually backfires, that we are telling them that there should be a problem, and it becomes a problem because we're telling them.
Oh, like that, what's an example? That sounds terrible. I get you though.
Scott Lilienfeld, who passed away recently, but he was a professor at Emory University. He talked about these potentially harmful treatments that we might have in clinical psychology. And one was this emergency response. If there's a stressful event, send in a bunch of psychologists, have people talk about their feelings and their problems. And he said, if you look at the trajectories after this, people end up having post-traumatic stress disorder, versus if you just let the natural resilience happen, back to normal. And, I just know clinically, I've seen these type of situations where, people have been at like a veterans hospital, and, you need to talk about what happened in the military, and that talking about it sort of, gosh, this sounds terrible, but like we're always trained, we need to work through this and work through it. If we let our natural system work, sometimes that just works well enough, I think. So I got a little off topic there, but I think for the most part, we're more resilient than we think we are.
That's, I would imagine, a little controversial, because so many people are wedded to the process. And I'm thinking of funny examples, because we might as well talk straight here, but you go on Facebook and somebody puts a picture up of their dog, rest in peace, Rusty. He was such a faithful companion for 14 years, and I'm heartbroken. And then you get 100 condolences, and it's like, look, man, your dog lived for 14 years. You gave it a good life. It's dead. There was another shooting that the country had to process by perspective. And so maybe if you make a huge deal about your elderly dog passing, it takes on more, there's more grief and sadness generated, instead of just, quietly saying goodbye. I don't know. I'm sorry to offend dog owners, and I'm one myself. My dog's 15, and when that dog goes, it's going to be a sad day. But then we can just celebrate the wonderful lifespan and put it in perspective, I guess, and let our natural immune system, return us to calibration.
Yeah. I think that's the biggest part of it, is that, I don't know if asking for condolences and those type of things is making it worse, but yeah, the idea that I'm not going to, I think the message is, if a therapist comes right up to you and, like, let's say there's a new Facebook intervention, like, we see your dog's died, I'm going to come and, call you. Maybe you need to talk about it. I'm giving the message that you're not going to be okay. And I think that's where the problem is that, by telling people that you can't handle this on your own, that's our implicit message sometimes, where I think people have an immune system that, just same thing with the win lottery. Nobody goes up to a person that's a lottery winner like, oh, you're going to be too happy. These are natural emotions that we can feel and we can process. Our body's good at that. We need these emotions in order to function properly. And I think we're almost telling people it's not okay to be sad. It's not okay to be affected by this. So I think that's where I was getting at, is sort of our natural response or immune response to these events is to generally get better. Not saying everybody gets better. Some people do need help, but so.
That's also interesting on the flip side, where the lottery winner is going to come back down to baseline no matter what. It reminds me, there's a great book by the psychologist Gay Hendricks. We'll have the title in the show notes because it's slipping me right now, but he talks about how everyone's got kind of a set point, a happiness set point, and you do things in life to kind of bring you back down to it if too much good fortune comes your way. And then even when you're into struggle and difficulty, you're going to be drifting up to that set point with a more positive attitude than the next person who's got a lower set point. And he's talking about raising that set point and discovering how you might be more deserving of even more abundance and happiness. But it takes work to kind of break through this ceiling that's been created from whatever childhood programming and all the things that we talk about today or point to that, you know, put us in our current situations.
Yep. No, it sounds like a great book. And, you know, in different cultures, people have different levels of happiness. And I think in our culture, we think we should be happy all the time. And, you know, some cultures, the expectation is not that. And maybe they're, you know, maybe built better for stressors. They just expect to have these stressful life events. And I think that's maybe the, you know, it's that sort of anti-fragility. You know, we need to feel other emotions. You know, I think we can't just be happy. We can be, you know, a little sadness for me here and there is not bad. A little anxiety, you know, teaches me a lesson. I learned something from these, you know, sort of events. I don't wish it on anybody. But I think that, you know, and nor do I try to find these things, but if I have it, I think the Buddhists are very good at, you know, these are emotions, and running away from these are, you know, one of our biggest reasons for discomfort. So,
well, I'm thinking of my recent interview with author of Dopamine Nation, Dr. Anna Lemke, talking about how as soon as we start putting numbers into the mix, that's when we have you know, an inappropriate overstimulation of the dopamine receptors, where, you know, we're doing something for the pure love of the activity, and then someone says, "Oh, that's a beautiful work of art. You should sell it at the gallery or the showing," and then no one buys it, and then you feel sad. And we're definitely locked into this consumerism culture here in the USA. And then I'm referencing like the studies on the happiest countries for whatever they're worth. Very interesting to read, but flooding the top rankings are the Scandinavian countries, Iceland, Denmark, Norway, Sweden, Finland is like 1, 2, 3, 4, 5 every time they do these surveys. And one of the attributes that they point to is that these countries happen to have tremendous income equality, a lack of income disparity, whereby the US, of course, has the most extreme income disparity of any population in the history of humanity. And that lends it to a lot of potential for anxiety, depression, you know, comparison, flooding the dopamine receptors, and then feeling ennui, even though you're a very materially successful person, and all those hazards.
Yeah. Two thoughts on that. Like I don't know if it's SEC or what regulation agency thought that it would be a good idea to have CEO salaries published, thinking that this would shame, you know, companies not paying their CEOs more.
Oh.
And it had the opposite effect, because now you could see what CEO at another company is making and use that as leverage for your position. And it caused this sort of, you know, I am not happy because I'm making less than company Y in this comparison. So it backfired on them, that, you know, this more, it created even greater CEO salaries, and, you know, because people demanded it. The other piece, going back and switching topics again, there's importance of making mistakes. And, you know, I think as we get older, we might think we shouldn't be making mistakes, and, you know, we need to be perfect. And that's another thing that I think people are afraid to be vulnerable with, is making mistakes. And Bill Roberty, I think that's the person's name, became a world-class poker player, backgammon player, and chess player at different times, in world-class rankings at different times in his life. And he said his strategy was to make a lot of mistakes. And what's interesting, there's a part of the brain, right in front of the cingulate cortex, and that registers, it's sort of our oh crap network. It's, you know, something doesn't feel right. It brings together the emotions and thoughts, and then the frontal lobe can process it. And we learn a lot when we start to feel that, oh crap feeling, like I screwed up, I messed up. And to not be afraid of that is one of the best tools for learning. And I think that's really neat. I know I've made these mistakes in life that I can point to, and I'm never making that mistake again because I learned from those emotional experiences. And so I think putting themselves out there is really important as well. And, to not be afraid to make mistakes and to screw things up, because that's how you're going to learn, take chances. So.
Yeah, I guess a young person, especially, the parents can lecture them about their misfortunes and mistakes, and don't you do the same. But the significance of the lesson is going to be magnified 100 times if they can go and figure out, something like that themselves. Of course, we don't want to repeat the accidents that occurred before the seatbelts were commonplace. So some of this is not going to be a good idea. But in other terms, you could loosen the strings a little bit and see what happens.
Yep. Yeah, I read this years ago, and I strongly agree with it now that I have a child. But the hardest thing about being a parent is watching your child skin their knee and picking them up and telling them just keep on playing. And I think we want to be protective of others, but it's important that they can get up and realize that they're capable and they're their own, and that to say the same type of thing with mistakes. I think my daughter gets ashamed of making mistakes, and I celebrate the process. You did it, you tried it. That's what's important, is the process rather than the outcome. The outcome doesn't matter. It's just taking the chance and doing it.
Yeah, there's a lot of cultural programming to unwind. Even, how old's your daughter?
4.
Yeah, I mean, that's that's pretty heavy, that somehow she's developing these beliefs from the world around her, from the well-meaning comments that whoever she's interacting with, and then she's stressed when she makes a mistake. And my kids are in their 20s, but I remember having numerous conversations where I was making an attempt to unwind the misplaced competitive intensity of youth sports, and having to talk to my son and say, look, this is it's part of the process. It's okay to compete hard and try to win, but you also have to remember that you got to let it go as soon as it's over, and not be afraid, and all those kind of things, which I think get lost in the shuffle when we're obsessed with winning and results and numbers in modern life here, especially with the trend to they used to call it the helicopter parent. Now it's been referred to as the lawnmower parent, because helicopters flying above watching everything, but the lawnmower is just paving the path.
Yeah, and I'm sorry, I'm going all over the place today in this discussion.
It's great. People, we're talking to Craig Marker, the kettlebell guy, unmasked as an actual psychologist, and getting all kinds of interesting commentary. All right, we'll bring it back to exercise in due time, but.
Yeah, and maybe this is the segue to it, but I think about CrossFit, and I enjoyed my time in the CrossFit community when it was early on in the CrossFit times. But the reinforcement system for that, your name goes up on the board with your time, and at the end of the day, you want your time, or to be the lower than everybody, or a number of lifts to be higher than everybody. Where actually I should be focusing on the process. I should be making sure my such and such is perfect form, and this is perfect form. And instead of focusing on just beating everybody that day, like nobody in that gym remembers me beating them on such a day or doing the best Karen time. I remember it, but nobody else gives a crap. So why do we get so focused on these outcomes when I could have been spending a lot more time on, getting really good at this, rather than some sloppy muscle ups that, just to get done with a routine.
So how do we find that balance point individually, where we know that we respond to incentives and recognition, but we don't want to tip it out of balance? And I'm referencing my triathlon career, where I was a professional. So this was everything to me. This was my career. It was, apparently very serious, very important, and all those attributes. However, I would routinely struggle when I got too stuck up on myself and too obsessed with the results. But again, it wasn't a recreational pursuit where I could say, I don't feel like swimming today. It's kind of raining. And so I was constantly walking this tightrope where I had to maintain a high level of competitive intensity and goal setting and focus, but I didn't want to get ahead of myself. And I made that mistake frequently, trying to find the center of power where you can be a process-oriented, highly competitive athlete, able to accept both success and failure gracefully.
Mm-hmm. Yeah, I think I have a great answer. Carl Rogers said something, the paradox of change is that you have to, something like this, accept yourself before changing. And so you have to have acceptance of where you're at, that you're, this type of thing. And then you'll feel comfortable changing. And you always have to have that sort of radical acceptance of where you're at. I think very pragmatically about mistakes. If I make a mistake, I try to cry like a baby, learn from it, and then move on. Like a baby cries, they get over it very quickly. And, that's the type of thing. I think we, cry like a baby, learn from that lesson, and then forget it. There's no reason to ruminate on it anymore, because that's just going to make us miserable. We've taken our lesson from it and we can kind of move on. That's the best I have on that. But
That's great.
It's the human challenge, I think.
Yeah,
so
you can make a shirt or something. Cry like a baby and move on. So I'm thinking about that pop in your bicep, and I'd like to talk about that appropriate loading of challenge and progressing with your fitness with minimal risk of setbacks that occur from overdoing it or extending beyond your capabilities. And if you have any nuggets, especially for us in the older age groups, because I think my brain is still stuck on whatever age, 32 or 27, and that part's a challenge right now.
Yeah, my favorite quote, Neil Stephenson said something like, until a man is 25, he still thinks that, if his family, were murdered, he'd go into a ninja and like train as a ninja and can be, I don't think the age is 25. I still feel like I can, do whatever I need to, go into ninja training, whatever it is, and become a ninja. That's my mindset too. Like I feel like I'm gonna beat, the 30-year-old kid next to me, doing the snatch test. And that's where I need to be realistic, that I probably can, but you know what? I probably should do the proper warm-up, probably should test this out a little bit and not, just jump right into it. I know I could have did some prep work that probably would have prevented all that. So that's where maybe I should have been more mature and thought about the situation a little bit. But yeah, I don't know if it's our testosterone, if it's the drive, the competitive drive that we have, what it is, but that can be problematic at times.
But what's going on in the body when you can get into a peak performance state? I guess it's inflammation or something, and these little niggles and aches and pains are suddenly vanished, and your mind is optimally excited and uninhibited, like Tudor Bompa says, and so you're ready to throw down. And I have a wonderful practice session where I do 20 full high jump approaches, and my technique is getting better, and it feels like a thumbs up. I'm walking away from the track with a bounce in my step, feeling good. And then the next 3 days, I get the message like, dude, you're not supposed to do 20, you're supposed to do 12. And what were you thinking? But at the time, I thought I was clear-headed and thoughtful and rational.
Yeah. I don't have a great answer for that. I know Pavel used to always say, things like, I don't care about your feelings, don't care about your feelings at times. If you feel like you can lift more that day, if it's not in the program, it's not what you're going to try that day. There are days that are built to, take off the governor off the system and, do what you feel like you can do that day. But if it's not in your program that day, and maybe that's, we need to have more intellectual approach and, that those type of days, like I didn't have that in my program on Saturday when I did that. And I shouldn't have I know better than doing those type of things, but I didn't follow my own advice as usual. So
Yeah, that's a good one. I think you have to bring the intuitive component in and reason with the circumstances. I'm thinking of like coming back from the high altitude training camp where we trained awesome for 3 weeks straight, and we ate and slept and trained and got fitter and fitter. But of course, it was an extremely stressful event. And then coming down back to real life, and you still feel great, but you have to say, look, I've just had an incredibly strenuous block of training. It makes a lot of sense to take a recovery week here, even though I still feel great. And I remember having those sensations a lot because of I guess it's the chronic stimulation of the stress response. You actually do feel good the next day and the next day and the next day because you're bathed in too many stress hormones without recalibrating back to a recovery state.
Yeah. Yeah. And I think, Pavel's looked at a lot of the old Soviet training programs, and you can Curtis, I'm forgetting his name. He was a famous Soviet coach, weightlifting coach, and he competed in the Olympics himself, and he won a silver medal, and he was supposed to win gold, and he felt so much shame for it. He said, I'm going to dedicate my life to making sure no one else feels ashamed.
Oh my gosh.
And he measured all of the athletes and like looked at training programs and those type of things. And what the Soviets did was they have a normal curve of training, and they did between 55% and 85%. They did most of their work of their 1 rep max. So it's all in a very doable range, and they very seldom went above 85% of 1 rep max. Their lifters were known to get their world records still hold. The weight classes have all changed, but if you look for pound, for how much they weighed, or kilogram versus how much they weighed, they still would have the records. The Bulgarian, and some of them, like I think one was winning it at 36, 32. They had great long careers. The Bulgarians trained in a just much more intense. A lot of their work was 90% above 90% of 1 rep max or above. And so they were training their system, stressing it. And a lot of their lifters were out, they were winning a gold maybe at age 22, but never to be seen again, and just injured or just not competing again. So I think there's something to building a program where you're not pushing yourself all out very often, but you give yourself the windows when you can, so you can feel those, those great days as well. And it's got to be more intellectual, I think, and you can use your insight when you design the program, but you're kind of building, there's variability, some days are easy, his system is very simple. You have light, medium, heavy days, and they vary, and you only have one heavy day a week, and the next, it just cycles through. And I think that's a smart way to train. I don't follow my own advice, but
well,
maybe
you're on a time schedule because you're so busy and you have a chance to fit a workout in. And of course, why would you go there and do a 55% of 1 rep max workout? For the average Joe like me making these calculations, it's like, that's ridiculously light. And I don't think I've ever lifted a weight that light in the course of a workout, because it's like, what am I doing? I drove to the gym. I waited in line to to beep my tag and get a towel. I got to go get some work done now. But that's an amazing insight that these world level guys, and I'm just thinking of, I was just reading about Elaine Thompson's training, the fastest female on the planet at her very peak. And she was listing her workouts, and one of them was like 10 times 200 meters at 5K pace. And I'm like, wow, is that a misprint or something? This sprinter who's running, 10, what did she just run? 10:51 last year in the 100, probably the greatest performance of all time. And she's doing a track workout at a 5K pace. That's, so far below in actual, capability of running sprints like you might imagine if you happen by her track in Jamaica. but it was a real revelation to think they're just there and moving their legs and building and building and building without crushing themselves like the average CrossFit enthusiast, or the triathletes go to the track Tuesday night and have their track session, and they're huffing and puffing, and they're running at way higher capacity than an Olympic athlete comparatively.
Mm-hmm. And maybe we can use a food analogy. I mean, it's almost like you've got something really good and you just take those extra bites, and we probably shouldn't. That's when we don't follow emotion. I think there are times we should follow emotion, but maybe if you're just feeling good that day and you probably should quit, that's when you should quit. And that's the hardest decision. I'm right there with you. When you're feeling good, you just want to try it. I think I can do a PR today. Yeah.
We have some reinforcement now, people. We're talking it. We're bringing it to the surface. This is that point where you have to ask yourself, what am I still doing here? Have I hit my effective minimum dose or what have you? But the food analogy works really well because, you know that 3 bites of cheesecake is plenty, and it's a wonderful celebration, and you deserve it, and you're going to enjoy it. And if you stepped away from the table right at that point, that would be ideal. And then the rest of it's going to feel gas, bloating, regret the next day or whatever. Have that control.
Definitely. Yep.
All right. And it's great to catch up with you. I'm glad we went off onto different paths today, because I think a lot of it applies to our health and fitness goals, and we brought it back pretty well. So thanks for checking in. Good luck with your dunking, and hopefully you didn't hurt your arm too much from that little challenge, but
it was just enough to activate my AACC in my brain that says, "Oh crap!" And I learned a valuable lesson from
yes,
it. So,
there we go.
Don't screw around with this.
Yep.
I need to. Yep. So it was a very lucky lesson that I didn't get hurt. But.
Yeah, especially warming up and preparing properly. And I know whenever I skipped those steps when I was young, it didn't matter at all. I would, jump right off my bike into the swimming pool and be off with the next workout. And now everything needs that, methodical preparation to bring the body to readiness for whatever you're going to do that's, significant.
Yep.
Dr. Craig Marker, people, catching up before his busy day on campus teaching kids. And I like those tips to get out of your comfort zone and bring in a little stress and challenge, some mistakes, and then learn and grow from it.
Brad, it's always a pleasure to speak with you. Thank you so much.
Thanks for listening, everybody. Dun, 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 dun.